For the first time ever since the COVID-19 pandemic broke out in March last year, health authorities had to face the tough question of which COVID patient deserves a bed at a dedicated treatment facility or at a hospital in the backdrop of surging daily infections. The authorities had to look at home care for patients who are either asymptomatic or showing mild symptoms. A pilot project in this regard was launched in the Kaluthara district in May, and today it went island-wide. The 24 hours hotline 1390 is set up by the Ministry of Health to keep tabs on home care COVID patients.
This is available for people from age 2 years to 65 years, those who have a positive PCR test or a positive rapid antigen test, and they are also asymptomatic or mildly symptomatic, and there is no long-term comorbidities, and there should be an environment suitable to be cared at home at their premises. That is, if they have a separate room for the PCR positive person to be, and enough sanitary facilities to be isolated from the rest of the family. And they also should have a continuous way of communicating with the center for continuing the care.
Home care, however, is not open for all persons who test positive for COVID-19. Instead, there are certain conditions which have to be taken into account in a patient assessment process.
How this system works is when a positive PCR or a positive rapid antigen test is detected, this information is transmitted to the area MOH and his team, and the area MOH and his team will do an initial assessment to see if the person is suitable to be at home and be cared for. In that event, that person will be cared at home for 14 days. During this home stay, every day at least twice a doctor will talk to them over the phone, and their condition will be assessed, and if there are any deterioration or new symptoms being developed, they will be admitted to the hospital. So after 14 days they will be released from home care and isolation. Pregnant mothers who are 24 weeks and above are not eligible to be cared at home. So any pregnant mother who is COVID positive and less than 24 weeks of pregnancy and there's no other comorbidities, they can be cared at home.
Some factions in society, however, are alleging that the COVID home care program risks lives of people, saying that more deaths could occur at homes. But the Ministry of Health sees no grounds to harbour such fears.
නිවෙස්වල මරණය සිදුවෙන්න පුළුවන්කමක් වෙන්නේ නැහැ. මොකද දැඩි අවදානන් සහිත කිසිම කෙනෙක් නිවෙස්වල අපි රැක බලා ගැනීමට බලාපොරොත්තු වෙන්නේ නැහැ. ඒ වගේම තමයි යම්කිසි කෙනෙකුට රෝග ලක්ෂණ විශේෂයෙන්ම බරපතල රෝග ලක්ෂණ තිබේ නම් කොයිතරම් හොඳින් ගෙදර ඉන්න පුළුවන්කම තිබුණත් අපි රෝහල් ගත කිරීම මිසක් එතන තබා ගැනීමට අපි කොහෙත්ම බලාපොරොත්තු වෙන්නේ නැහැ. ඉතින් ඒ තත්වයේ තුල මේ ක්‍රියාවලිය හරහා ගෙවල් වල සිදුවන මරණ වැඩි වෙන්න ලැබෙන්න විදිහක් නැහැ. නමුත් මේක වැරදියට පාවිච්චි කරගනිමින් බරපතල අඩි අවදානං රෝගීන් විවිධ ක්‍රමවේද මගින් නිවසේම රැක බලා ගැනීමට උත්සාහ කළොත් මං හිතනවා නිවසේදී මරණ වීම යම් ප්‍රමාණයකට වැඩි වෙන්න පුළුවන්.
Glow and Handsome. ඇති මල්ටිවිටමින් සහ UV ෆිල්ටර්ස් දෙගුණයකින් වැඩි දීප්තියක් ලබා දෙයි.
මූණ ගැන හිතන්න. හිරු කිරණින් ආරක්ෂා කරගන්න.